Hello everyone, my name is Joanne Callinan and I work in Milford Care Centre in Limerick. I was very interested in applying for the Education Fellowship because I have been involved in working in e-learning, and I suppose more so in the last year involved in the development of e-learning programmes with funding from the All-Ireland Institute of Hospice and Palliative Care. So they provided an excellent opportunity when I saw that there was an Education Fellowship. As part of that, I decided I'd apply, and I was very interested in visiting a number of sites, really healthcare organisations, and learning from other healthcare organisations that were involved in the development of e-learning programmes. The organisations that I visited were the Royal College of General Practitioners, Laras Hospice, Hospice UK and Macmillan UK. As part of this presentation, I'm going to really give an overview of the sites that I visited, and I'd really like to, thank firstly, the All-Ireland Institute of Hospice and Palliative Care, especially to all of the sites because of the time, and they give a considerable amount of time in sharing, their knowledge and experience. And I'd also like to thank Milford Care Centre for enabling me to visit the organisations as well. So the first organisation I'm going to just look at is Macmillan, and Macmillan UK are they're a large organisation in which provide information, support, advice, and care on cancer, and they provide a huge range of e-learning resources. They also use Moodle as their learning management system, and they also use Articulate. All of the organisations that I visited, in fact, used Moodle and Articulate. And from that viewpoint, I was actually very interested in learning more about how the different organisations use these resources, which are resources that we were using as well. They offer many online courses to health and social care professionals, but they also offer resources for the public, volunteers, and to their own staff. So there's a huge huge range of courses that they were involved in. The name of their site is called LearnZone, and it provides, these are free learning resources, online courses that are available. The courses then can be accessed through learnzone.org.uk, and I have a link to it there. From their website, this is the screenshot from the homepage of LearnZone, and as you can see, you have, what I liked about it, is that you very clearly can just go in by different professionals, so by either professionals, the public, the volunteers, or health and social care professionals. So that's kind of a very clear navigation into the different resources. They also have different ways of browsing, so you can find the course that you're looking for through A to Z list. And you can also again go in through here. The resources that are available are in different formats, so some of them are online, some of them are through videos. This is just an example then from a screenshot from their Moodle, and this is out of hours palliative care. So with this particular module, there's a number of different topics available, and I'm just giving you a screenshot from the first two, which you can see communication issues and management of cancer pain in primary care. Most of the courses then are provided, developed using Articulate, and the first one you can see there is the communication issues. After each of the courses then there's the course itself, and then there's a self-assessment. So that's the format. So there's a number of topics, and they're all quite short, and that was one of the features, one of the biggest learning outcomes for me is to keep it, as really what's come up time and again, is to keep it short and to keep it simple, but it's never that easy. People always want to keep adding that little bit more in, as I was today with this particular presentation. So I'm going to give you a screenshot from this is developed here using Articulate. I think it's very visual, and I think that's the first thing to say about it. You can see the navigation icons, and this was one of the interesting features for me about doing attending the different and visiting the different sites, is just to see the different ways organisations develop their programmes. And I'm going to also just show you, similar to a course development process that the Royal College of GPs are using for their courses. So Another screenshot from the same program, which is the communication skills program, is on verbal skills. And again, you can see again the use of interactivity here to engage their users with the program. And quite simply, when you hover over any of the different, we'll say active listening or open questioning, it brings up information about it. Also along the side, the learner can see how far they are in the program, so by the level of the green there. Then from just simple Moodle quiz, this just again shows you just some questions from their Moodle quiz. And that one there is which of the following skills would enhance good communication, and the learner then, there's about, I think, something like maybe 5 short, they're very short self-assessments at the end of each of them. Again, similar to the other, you get feedback if it's correct, what the correct answer would be beside it or incorrect. This came up actually in a few organisations, and there is legislation, I suppose, really with regard to accessibility issues and disability, and ensuring that any material now that is produced, because the organisations I visited were in the UK, there is sort of a requirement to ensure that if you're providing, I suppose, material which has audio, that learners who have learning difficulties or who might have hearing difficulties, that they are also able to access the resources. And how they did it here with their video is you can see that you can click on the link just here to transcript, and then the actual transcript of that video comes up nicely here, which I think isn't too imposing, because sometimes you're kind of going, how am I going to present the text alongside the video? It produces challenges. So that's, I think, a kind of a nice, easy way of enabling different audiences to be able to access the resources. And I suppose because they are providing, they are supplying it to, they have audiences, volunteers and the public, you need to ensure that information is accessible. Here's a nice one, I suppose, of introducing reflection rather than just giving the information, maybe just providing a little reflective piece to ask, just to stop and think. And I think they just sort of do it quite nicely there. One of the goals, to just give them a question, think about it before they move on. The next organisation I'm just going to look at here is just a screenshot from Hospice UK, and Hospice UK are a large, I suppose they're an organisation in the UK that provide, they're an umbrella organisation for other hospices, and they do provide a lot of support and advocacy to hospices in the UK. They also have, they use Moodle, and again they use it maybe in a slightly different way. They don't use Articulate, but they use Moodle. They call it Current Learning in Palliative Care, so they shorten that to CLIP, which, as I said here, you can see that each of them, you have a list of different topics. So introduction to palliative care, helping the patient with pain. So within each of those then, there is a link to that particular, we say, lesson. And here's just an example of what is palliative care: meeting the very ill adult for the first time, making sensible decisions. And they're all really, these ones are all based at introductory level. So that just gives you a kind of an idea. Within each of these pages, and I'm just to give you a screenshot from what is palliative care, you have an activity followed by the actual lesson. Now, these lessons are very short. They're much more like an actual page as opposed to a lesson. So they're very short synopsises of what it is, and then a kind of a very short quiz afterwards. I also visited Laras Hospice. They're based in Leicester, and they provide hospice services, which would also include day therapy and community services in the Leicester area. This is the screenshot from their website, so you can see that they're very much yellow and red are their kind of template colours, and they are involved in developing mandatory training for their staff, and they use Articulate. So as part of that, I had a look at their mandatory training. They use Moodle as well as their e-learning platform. They use Articulate, and they have a range of, I suppose, mandatory training courses that they provide. Kind of one's health and safety, information governance, equality and diversity. How they do it then is that they'll divide, and I suppose this is always a challenge, how you're providing it for your staff. They divide it into 4 cohorts on Moodle. They have a cohort for doctors and nurses. They have a cohort for other clinical staff. They have a cohort then for the non-clinical patient staff, so non-clinical staff, maybe reception, who might be dealing with, who might have contact with patients or porters, and then maybe non-clinical staff who don't have any patient contact. So that's how they kind of, and I thought for me that was kind of a good kind of way of looking at it, because you kind of, we all have those kind of groups, and we're kind of going, well, they have this mandatory training and they have that mandatory training, so how do we actually put that together on Moodle? Yellow and red, as I said, are their template colours, and they do carry those through and give a very much similar look and feel. For me, it was kind of just interesting to see visually how they do that. They have their logo, and they just kind of have a very much a standard template across all of their mandatory training. The title and a little bit of information about the training. This particular one is on safeguarding adults and children, and this is just an example of a case study which I thought I'd show, because it's quite, again, they use the yellow, which is their kind of, their strong template, their strong kind of colour, and they give an example, and they have their questions on the right hand side. So you get a case study of a volunteer working in Laras shop, and a scenario where what should you do, and look at the options below. And I think the introduction was that they have a number of case studies, especially in this particular one. They have 4 case studies, and how can we provide good practice. This is another nice interactive one, which you could again use for your, I suppose, developing e-learning programs. And again, it kind of just gives you ideas. This is an example of one for health and safety, and so you can see, are you sitting comfortably? So you have your 2 images, and when the learner has to click on the numbers below for more information, so the little icons then are numbered, and you get your correct seating position here. The last organisation I visited, and this is with the Royal College of General Practitioners, I spent quite a good bit of time in this organisation, and a very large organisation. They provide professional membership to family doctors in the United Kingdom, and they are involved, and they have a very large dedicated e-learning team, which is one of the reasons I was interested in visiting the site. And they have been developing e-learning for the past 6 years, and they have at the moment over 300 hours of e-learning. They develop it themselves in-house, but as I said, they have a very dedicated team. So they also have produced 62 e-learning modules, essential knowledge, updates and challenges, and professional educational plans. And I'll speak a little bit about some of those. Obviously, their intended target audience are GPs, primary healthcare professionals, GP specialty trainings, and GP educators. But they have approximately 50,000 registered members, but on their e-learning itself they have more than 60,000 e-learning users, so which sort of goes to show that not all of their users of the e-learning programs are GPs. Then when it comes to, I suppose, developing the e-learning programs, there's a project team involved. With the e-learning programs, oftentimes a partner organisation will approach to maybe discuss the development of a particular e-learning programme, and a relationship manager will initially make contact with the partner about the development of that course. So for example, I'm going to show you a course called MND, and it was the MND, the Motor Neuron Disease Association, that were a partner with the Royal College of GPs in developing this programme. So they'll meet with the project team, the e-learning team, and any other stakeholders. I suppose we've kind of talking here, there's really, as we mentioned a lot, a multidisciplinary team approach, and in developing the e-learning programs, there were a number of individuals, and I was very fortunate, I suppose, to meet a lot of these professionals. They were content experts, IT experts, and so again, it sort of, I suppose, emphasises the requirement to have that blend and the kind of coordination that's required, and collaboration, and the constant toing and froing, communication is really essential. So the e-learning program manager, medical director, I mentioned the relationship manager initially. Project officers then might be involved with a number of e-learning programs, so they really oversee the coordination of a number of e-learning programs. The The e-learning development fellows and the authors are general practitioners, and they're obviously the content experts involved in the development of the content for the programs. And then the instructional designer and the senior web developer are the involved in, I suppose, developing it from the functionality and the IT perspective. So the next stage then, I suppose, once they've decided that they're going to go ahead and they're going to develop the e-learning program, is to develop, I suppose, a scoping document which really kind of gives an outline of the aims, objectives of the program, and a course map, so how many modules it's going to contain, and types of assessments, and I suppose an overall outline of the course content and scope of that course. And that's developed initially by the e-learning fellow and the authors. This then is really, I suppose, an overview of the whole process of developing the e-learning program. And it kind of, again, it starts off really, I suppose, with the scoping document. The next stage then is drafting the content, which the drafting the content is done by the e-learning development fellow. Will have been involved at the scoping, but they're much more involved with the author here as well in developing the content for the program. The content for the program is actually developed in PowerPoint, and following on from the content, the storyboard is drafted by the instructional designer. As I suppose the storyboard then is really whereby they're going to take that content and look at how, what images are going to be used, what interactivity is going to be introduced into the online program. Are there going to be videos? Literally going through the whole program and storyboarding it with the author as well, and the e-learning development fellow. And they use detailed templates because they have been involved in developing e-learning programs. They have templates developed in PowerPoint for that, and also in Articulate. And it was really interesting for me to see that, because I was kind of going, God, yeah, I have a lot of these, but it's really about how you can maybe take what you already have as well, and maybe consider using them as templates, so you're not recreating and having to I suppose to redo it again. So use the templates, and at this point then, once the storyboard has been developed, and it's really it should at this stage, it should look as it is going to look in the finished e-learning program. It's sent for peer review and for clinical review. Then, following on from that, it may be required that the content needs to be updated. If the content needs to be updated, it's sent back again to the storyboard, to the instructional designer, and it's updated. Then it's sent for editorial review again. And following on from the editorial review and clinical review, these all go to the content experts. It's only at this stage that the course is actually built. So once it has actually gone through that whole peer review process for content and for editorial review and clinical review, once it's signed off, then it's finally goes for story build. For me, that was quite interesting, because in developing the program, I would have done the storyboard, but it was a continuous to and fro. So it was interesting for me to see how that process was actually done, and that it was at this point that you actually go into start using Articulate. Up to that point, the instructional designer was actually using PowerPoint and putting in would say, well, this is where there's going to be interactivity, this is where it's going to be on the PowerPoint, but it actually isn't done until it goes to the next stage. So after that then, when the course is built, there could potentially be sent then back, and there is a possibility that in the meantime something minor might need to be changed. As always, the last minute updates. But really, at that point, when it is initially sent, it shouldn't at that point, they say, have to be changed. It goes then for technical review, and again, you need to ensure, I suppose, that it is responsive on different devices. It is responsive, I suppose, in different browsers as well, because usually when you kind of come to the next stage and it's only afterwards you realise, oh, it's actually not really functioning correctly here, or somebody comes back to you and it's so a lot of these technical reviews are done before this. The final clinical review and sign-off stage is at the medical director in the organisation. So it's at this point then that the final e-learning program is launched. I suppose for me it was very interesting just to see the different steps that are involved in the development process, and I suppose we had been using some of them, but it's just the sequence of events. This is an example then of a lesson from the motor neuron disease. All of the lessons have a similar, they all have actually a similar style. So they'll have the course title, your course description. The duration of the course usually is only between 20 and 30 minutes. And I suppose that was one of the keys, is just to keep them very much bite-sized, 20 to 30 minutes at most. Publication date, September 2014, and then you have your e-certificate. So on completion of, we'll say, it says here, pre-course assessment and the post-course assessment, they can actually access their certificate. This is then following on from that. When you click on the motor, further down the screen actually, you have the learning session. So essentially you just have the pre-course assessment here, the lesson itself, and then the post-course assessment, the references and the acknowledgements. So on the Moodle page, it's actually quite simple. There isn't a huge amount of information. They don't have a lot of scrolling. So they do their pre-course assessment, and then they just click on the lesson here for the motor neuron disease. So this is the next screenshot, which is actually the lesson for the motor neuron disease. And as you can see then on Moodle, you have your lesson navigation. So the user can actually navigate very easily through the program. Again, you kind of get estimated time, the author, and it's within a particular curriculum as well. At the end of every lesson, you have the key points. So again, if somebody had already maybe knowledge of that particular topic, they might want to just go to the key points and look at that. So an example here just from the pathophysiology. What I liked about it again was, here's a nice image and interactivity. You just click on any of the areas here and you get a brief information about that particular image. So there you go, brief recap. And here they ask, there's an actual question, and in this case, which of the following are features of M&D? So the learner goes through it, they tick the box, they click submit, they get their answer and they get their feedback as well. What's nice about this is that this particular question is just asked in the middle of the it's asked here in clinical features, which is in the middle of the lesson, and they're not given the actual information then until about the particular section of the clinical features until they've answered the question. So it sort of kind of assesses their knowledge, gives them the answer, and then it goes into so it sort of sparks their interest really again before instead of just giving the learner the information. And again, click on each of the clinical features here for their explanation. So what's nice about this one is that they actually introduce a little video, it's a very, very couple of seconds of a video, and it just shows the particular tongue vasculations, and I suppose it makes it a little bit more, I think, real when you can actually see close up what's going on. Another one here then, again, for motor neuron disease are signs of bulbar features. So again, you get nice images, nice diagrams, and I think they were saying that, again, with diagrams and images, that they are obviously copyrighted, so you need to be careful, and they use those from the Wellcome collection, which they have, I think they have permission to use. So as with all e-learning material, to be careful of copyright for use of images. There's just, again, nice examples of just visual illustrations and interactivity for the user, so when they click on it, they can find out more. This again is just another screenshot, which again shows, I suppose, a reflective piece that says motor neuron disease doesn't matter, and gives some information again, and the user then types their answer in the box. So it's for them to think really about their clinical practice and before going on through the lesson. So it's a midway kind of reflective to get the learner engaged in the e-learning program. Again, a little bit more interactivity in the middle of the programme. So rather than just giving your learners information, you can maybe do, here they have matched the descriptors to the most appropriate type of MND. So types of MND, and here you have the most common form, 75% of people, and they click the drop-down list. So what's the most common type? Then they ask them, affects the muscles of speech and swallowing. Again, they click the drop-down list and they have to select which option they think. And it was kind of interesting then, because it's only then you're kind of giving in more information about the types of MND. So it's just ways of trying to get your, rather than somebody just clicking next, going to the next slide like a PowerPoint, that you actually get them to stop. Okay, you have to do a little bit of work here now, get them to just spark their interest before giving them the information. So again, they can just find out more about these types of MND by clicking on any of those boxes. So really the format for all of the lessons on the, for the Royal College of GPs is that they have a pre-course assessment, they follow that with their lesson, and they have a post-course assessment. And all of them then are linked with a certificate on completion and linked to references and resources and acknowledgements. And I suppose with a lot of the e-learning programs, they do follow quite a similar format as well. Another product of the Royal College of General Practitioners is the Essential Knowledge Updates, and these have been in development since 2008. The Essential Knowledge Updates then contain 8 major briefings and 20 minor briefings. And essentially what they do is every 6 months, a very comprehensive search of the literature is done by the education team in the Royal College of GPs, really to bring together, I suppose, any new or information that may change clinical practice. And this then is presented as what they call 8 major briefings, which in a way are quite like the lessons in the other section. The 20 minor briefings then are really only, I'm going to show you a screenshot from one of those as well, but essentially they take one article and they'll just provide a synopsis of that article which they think may be of relevance, so they have 20 of those and the link to it. Again, as I said, they're developed in-house, and again, it's to suggest ways for GPs to, I suppose, to improve their own practice. And something similar, I suppose, you know, if you think about it, could be done in any area of healthcare, you know, looking at the most recent evidence every 6 months and say, well, how could this be presented to our clinicians, and how could they improve, maybe suggestions of way to improve their practice. And we could, you know, it could be done in a similar like e-learning format as well. This is an example then from the Essential Knowledge Update, and that's the home page. So again, you click on it here, gives you information about the update. The next screenshot really provides, as I said, there's 8 of these. So the first one, I chose this one because it's safe and effective prescribing of strong opioids for pain and palliative care. And you have your self-assessment, and then there's a number of other particular, they call them major briefings. So with each one of the major briefings, you have your self-assessment as well. They also introduce screencasts and podcasts as well into as part of their e-learning products. But as you can see, maybe that particular screenshot or screencast there is in relation to general practice and medical generalism. So it isn't available. They don't have screencasts for every single one of their e-learning programs, but in some e-learning programs they do that. That there is just a brief description of that particular safe and effective prescribing opioids. Again, along the right-hand side, quite clearly you can see the navigation. Just to show you a little bit of, again, you have interactivity. Quite clearly you can see that they do use a lot of images on the right and their text on the left as kind of a template. And always they kind of finish up with the learning needs and the service needs. So at the very bottom, how does it influence your practice, and what way can you, how can you improve your service? Before, I suppose, getting the certificate, this is just an example again from a clinical scenario question. I'm going to run quickly through that because I think we're running out of time. I just mentioned earlier that we have a brief, the very short briefings, and they're just one particular article that has been identified as being of relevance to GPs. So they barriers to GPs' use of evidence-based medicine, and really it's just a synopsis of that particular article followed by the reference link. The last product I'm going to look at is the Essential Knowledge Challenges. And the Essential Knowledge Challenges is that as part of these updates, so they have the new evidence that has been collated, presented to you as these kind of updates and challenges. The challenges are essentially 50 multiple choice questions, and that is to really assess the learner's knowledge based on those the latest evidence that has been presented in the updates. So at the end of each of those, if you've gone through the different sections, you can do the 50 multiple choice questions to test yourself on that. All of the products, I suppose, are available freely to general practitioners, to anyone who's a member of the Royal College of GP, and they can also be purchased as well. I suppose finally, there have been a lot of learning outcomes from the visit. Definitely I've learned a lot more about different approaches and I suppose for developing e-learning programs, and able to just compare the differences and the different ways of presenting e-learning courses to users. I've also, I suppose, really learned about the importance, I suppose, of the different professionals involved in developing e-learning programs, and keeping the lessons short and keeping them simple, and when using, I suppose, some video material, trying to make material accessible to different audiences as well. So finally, I'd just like to thank the Ireland Institute of Hospice and Palliative Care, Milford Care Centre, and especially I'd like to thank all of the sites, the Royal College of GPs, Laras Hospice, Hospice UK and Macmillan UK, who really did enhance my understanding of e-learning and how to develop e-learning courses. Thank you very much.